Hi, welcome to my page. I guess this is kind of an introduction. I hate doing these because, I don't know, when I watch YouTube videos, I hate when they talk so much. It's just like, get to the point. But this is an introduction, so I'm going to be talking a lot. So I am doing the ECT treatment. Tomorrow is my first day, so I'm like really nervous. But I've done a lot of research and I haven't found any bad reviews on it, other than the fact how it has like a big like stigma on it. But I don't know, everything, as time goes on, everything gets newer and they have newer technology. So it's not so bad, at least from the videos I've watched. So yeah, I don't know, I'm really nervous about it because it can cause memory loss, and I heard from the first treatment you'll get like really bad headaches, and you'll have like muscle aches and stuff, which is going to be really hard for me because I have fibromyalgia, which it's like my nerves are so sensitive, like I have like overactive nerves, so just like touching my skin hurts. So I'm really nervous about this. And then I have chronic migraines. So I get headaches. So I'm just hoping that everything runs smoothly. I'm hoping that they give me medicine. Afterwards, I'll give you guys an update tomorrow or the next day. But yeah, the reason why I'm doing ECT is because I have really bad depression. I have major depression. And my psychiatrist doesn't know if I have a borderline personality disorder or if I'm bipolar, because I don't know, my symptoms don't really match. And then when they do match, it's like, I don't know, like the symptoms like run hand in hand. So it's really hard to tell. But I have I'll have 6 really, really bad days where I like can't get out of bed, don't want to take a shower, don't want to do my makeup, don't want to do nothing. And then I'll have 3 like really, really good days. Like I call those my high days. Like I feel like I'm high off of some drug, but I didn't take anything. That's just how I feel. I just feel extremely high. And I feel like I'm on top of the world. So that sounds like bipolar, but with bipolar, it's like where you have like longer episodes, and with me, it's extremely short. I'm more depressive than I am manic, so yeah. But I don't know. I'm kind of excited about this treatment. This is kind of a last resort for me. My medicines don't work. Like it'll work for 3 weeks and then my body metabolizes them really quickly. So after 3 weeks, it doesn't work anymore. So then I'm off to the next thing and off to the next thing. And it really sucks because, usually you have to give it 2 weeks to get into your system. So I'm having like extremely like bad days and I'm extremely suicidal, and it sucks. I hate starting a new medication, especially antidepressants. Those are the worst. The one thing that I do respond to is like mood stabilizers. So I'm able to stay on like a mood stabilizer, but that doesn't help with my depression as much. So antidepressants help, but it's only for a short period of time. So yeah. But yeah, I've been thinking about ECT for about 3 months now. It's not something that I wanted to do. I was really hoping that the medicine would work, but it hasn't. I've been going through this process for a year and 3 months. I was just like dealing with myself and this depression, and it's been really hard because I can't work. Like with that and my health issues, it's really hard to work. Like I can deal with fibromyalgia or I can deal with my depression. I can't do both. And with fibromyalgia, like 6 out of 7 days I'm in pain. Sometimes 7 out of 7. So, and then I'm depressed, like for 6 days out of 7. So it just makes it really hard, really, really hard. And it's really stressful. So yeah, this is like a last resort for me, but I don't know. It has like an 80% success rate. So that's one of the reasons why I'm considering it. Medicine only has, I believe, a 40% success rate. So 80% is really high. Yeah. But I don't know. I'm really hoping it works. Like, I don't know. I'm really nervous because it's like, I know if I don't see results the next day, I'm just gonna be like really, really upset. And it's stupid because I know that I'm not gonna get results right away. I'm set up for treatment every every Tuesday and Thursday. You're supposed to do it 3 times a week, but the place that I have to do it at, it's the only place that accepts my insurance, is 3 hours away from me. And the treatment is at 6 a.m., which means that I have to leave my house like at 3 a.m. But I like to leave my house like an hour early, so I'll leave at 2 because, there's a lot of room for error. So I really want to make sure I get there and I get there on time and I do it because there's a lot of gas involved. And yeah, and then on top of that, I have to have a driver. So my best friend decided that she made this commitment with me that she will help me and she'll be there for me. So yeah, like you have to have a designated driver because of the anesthetic that they have to do to put you to sleep. So she's decided to do that, and she had to call off work and stuff like that. So it's like I gotta make sure I'm there. Yeah, so I don't know, I'm really nervous about it. I don't know if you guys know about ECT, but it's pretty much where, from my understanding, is that they're only going to do one side. They're going to put these things in my head that will shock my brain, and it's supposed to rewire my brain, because what I don't have, what I have is I have a chemical imbalance. That's why I'm depressed. Like thoughts in my head don't make me depressed. I'm not thinking about anything. There's not an event that happened that makes me depressed. It's not what I feel inside is I feel grief and I feel extreme sadness for no reason. It feels like my dad died or something, but nothing happened. Nothing at all. So that's why it's very important for me to fix it. Because I have a 7-year-old daughter that I have to care for, and and it's just half the time I feel like I need to go to a mental hospital. I just feel like I cannot take care of myself some days. So I mean, right now I'm able to fake it till I make it. And she doesn't know about this, but pretty soon if I don't get treatment, I don't know how long I'll be able to fake it. And I just don't want my daughter to see me this way. Yeah. But yeah, they put these electro things on your head on one side, and then they shock it, and the lady told me that it'll take about 5 minutes, 5 to 10 minutes. I don't know what they do in that time. I don't know if it's just one shock or or they shock my brain for 5 minutes. I have no idea. And then, and if that doesn't work for 12 treatments, I think they move it to bilateral, where it's right here and on the other side of my head. And then they shock it that way. But as far as I know, it's only one side. So I guess I'll give you guys the update, Friday or something. So in 2 days. But I don't know. I'm really nervous because I don't know how much pain I'm going to be in afterwards. The doctor said that he will prescribe me something, but I'm just hoping it's stronger than ibuprofen, or a really big dose, because with fibromyalgia, everything hurts twice as bad. So So yeah, but we'll see. But I only wanted this video to be 10 minutes long, so I'm gonna cut it. I guess I'll talk to you guys soon. Bye.